Now, if you've got children, you will know the value of a rare, quiet moment when the baby's asleep, but also how quickly that can be over if the doorbell rings.
And how scary it is when anyone makes any type of noise at all.
Yeah.
For the last 6 months, a postnatal ward at a hospital in Cornwall has been trying out silent call bells using smart technology to help keep it quieter and calmer for new mums and their babies. It's had a really big impact, as our reporter Anna Val has been finding out.
For many of us, a hospital stay can be a noisy one. But in this ward, those days are gone. If a patient calls the bell, the only sound you'll hear is a ping on one of these devices.
Hi there, I saw that you rang the bell. What can I do to help you?
This pilot project has been running for 6 months, and staff and patients say the difference it's made has been extraordinary. Ashley has given birth to 4 of her children in this hospital. She and her baby boy, Soren, spent 7 days here when he was born 8 weeks ago.
This time it has been noticeably different. When the ladies in the bay have rang for some assistance, you haven't known about it until a member of staff's arrived to come and speak to them. And even kind of other things, the way that people are talking to each other, it's a lot more quiet there.
And this means patients are more rested and go home earlier.
We've reduced our length of stay on this ward by 0.5 days, which may not seem very much, but if you convert that into cash, that's about £75,000 saved on this one ward in a year. If you take that across the whole hospital, that's quite a lot of money.
We had our Wi-Fi go down one day and they had the audible call bells back on, and so it made such a stark contrast between it being silent and it suddenly audible again.
So how does this technology work?
If you call the bell, I get an alert to my handset to say that you've pressed the bell. I can then press on the alert and I can click accept or decline. I'll click accept if I'm free to respond to your call, and then the alert will continually come back to me until I come to see what you need and reset the call.
The project has now been extended for another 12 months, where the technology will be developed even further. Unless it's an emergency, instead of the patient pressing the call bell, they'll be given a handset where they'll be able to choose what kind of support help that they need. They might press for the support worker if they need help with feeding. They might press the midwife if they need pain relief, or even the hostess if they want something from the food and drinks trolley.
The other thing we're looking to do is the interactive whiteboard, so then we will get reminders for tasks like when antibiotics are due, so that will greatly improve the staff experience as well.
So far, this is only operating here in the postnatal ward, but the long-term aim would be to roll this out across the whole hospital. Anna Val, BBC News.
We are joined now live on the programme by Saffron Caudry from NHS Providers. Morning to you.
Good morning.
I imagine the aim of this, the basic aim of this, is to try and minimise the length of stay for people in hospital, mums and new babies, to try and get them home as fast as possible, as well as possible, and not more tired than they need to be. What are the advantages of that for your staff and the hospitals?
Well, we know that anything that improves the experience of patients, which I think is as important as reducing the length of stay, is absolutely fundamental. But what we do know is when we can shorten the amount of time that patients spend in hospital, it does mean that it reduces the demand across individual wards, and that has a knock-on effect across a hospital or any other trust or healthcare provider. So it's really important that we remember that there's a really close connection between the quality of care that patients receive and also the length of stay.
But the great thing about this, I mean, it's dead simple and relatively cheap, isn't it? It's working in the maternity ward in Cornwall. Can you imagine this being rolled out to other wards, other hospitals elsewhere?
Absolutely. I think one of the really important things about this is that often it's small, seemingly small steps that can make a huge difference to the experience, in this case, of new mums, but it can be different kinds of experience. And I think what we need to remember there is that this is one of those examples of a focus on using technology, very simple technology, the Wi-Fi and a different kind of call system. Obviously, that depends on a good Wi-Fi infrastructure. We know that up and down the country, it's not always the case that the hospital wards can rely on really good Wi-Fi. So we do need to make sure we've got that capital investment in place to shore up the Wi-Fi across the NHS in England. But overall, it's these small innovations brought about by those who are closest to doing the work, who can really understand what will make the greatest impact.